Good afternoon, everyone. This is Katie Novotny calling in from Premier Marketing. As always, I appreciate you taking the time to join us today. Something that we have had a topic of conversation is home care. Post-pandemic, I think everybody's hearing it. People want to know how to stay in their homes. Today, we are thrilled to have a GTL product discussed. We actually have some of the product designers. We have Nick, Liz, and Tierney from the product designing company. And I wanted to go and have them discuss the opportunities where they're seeing sales and maybe some different ideas of how to approach your client on this unique product. So with that, Liz, you ready to take it away?
I am, thank you. Well, greetings everyone, and thank you for the warm introductions. As Katie had highlighted, my name is Liz Christopher, and I'm joined by my colleagues Nick Polish and Tierney Beauregard. We are thrilled to be with you today to introduce an innovative solution which combines insurance with navigation and advocacy resources. Now, you don't often associate insurance with innovation, but after today's presentation, we hope you come away with just that, a different way to think about insurance and a robust offering to enable your clients to realize their dream of aging at home as safely, as independently, and as long as possible. So before we get into the product details, did want to give a little bit of background and context on why we designed this solution offering. So all of our employees have either been a caregiver or have had to search for caregiver services for a family member or a loved one, as I'm sure many of you and many of your clients have had to do as well. As Katie had highlighted, we know the majority of people want to age at home now more so than ever, yet the emotional and financial burdens can be overwhelming, both to the individual and to their caregivers. In addition, the healthcare system is disjointed and fragmented, especially within the short-term and long-term care spaces. You couple this with the misunderstandings and misperceptions of what Medicare will cover, it's no wonder that there's a problem. In fact, the average person will consume roughly $50,000 in unreimbursed custodial healthcare expenditures in their lifetime, most of which is not budgeted or planned for. It's a massive blind spot for so many, and one which results not only in having to make difficult decisions from where a loved one ages, but also to the quality, to the access, and to the type of care that they may receive. And on a very somber note, these expenditures are the primary reason that individuals file for bankruptcy late in life. And so that's what brings us to Home Care Secure, which is our integrated solution combining an indemnity insurance product with navigational and advocacy supports to provide your clients with the tools, the resources, and the financial security to age at home. So at a very high level, the indemnity insurance product has available lifetime maximums ranging from $20,000 to $60,000 in $10,000 increments. The benefit's designed to pay over 50 weeks, thus leading to weekly payments ranging from roughly $400 to about $1,200. And because of the indemnity nature of the product, the money's paid directly to your client. Now, if we move over to the right-hand side, you'll see the Aging at Home Association, and this provides a robust set of tools, resources, and discounts that we divided into three main areas. So discounts and special values for frequently used goods and services, such as telehealth and durable medical equipment, care coordination services ranging from free online self-service tools to help you make a plan, up to discounted personalized services provided by a dedicated advocate who's trained in elder care. And then lastly, we also offer an annual total well-being assessment that we developed in partnership with Fidelity Investments and the Stanford Center for Longevity to take a holistic view of an individual in the areas of life, health, and money. So all of these elements work together to educate your clients on the emotional, the social, the financial, and the operational components to be able to age at home. One additional item I wanted to share is some results that we received from preliminary market research that we conducted with one of the nation's largest retiree exchanges. As you can see on this chart, the respondents placed an equal value on the association benefits of support, planning, and discounts on par with that of the cash indemnity benefit. So this reinforced our hypothesis that Home Care Secure and the Aging at Home Association are highly valued on an individual basis. However, when you combine them, they represent a very powerful and market differentiating solution. And with that, I'll turn it over to Nick to provide additional details on the product.
Great. Thank you, Liz, and good afternoon, everyone. So I'm going to spend a few minutes on this slide addressing the three questions that are likely top of mind with each of you. How do I qualify my clients? What are the key product features? And how do they qualify for the cash payments? So let's work our way left to right. So first, from an eligibility requirement perspective, there are simply three. First, your client must be entry age 35 through 84. Secondly, be a legal resident in one of the 22 states where Home Care Secure is currently available, and we'll review the states in a moment. And then finally, be able to pass the 5-question simplified underwriting process. And passing is the ability to answer no to each question. And you'll see in a few minutes that the health questions are very narrowly scoped. And based on our experiences to date, 90% or more of your clients will qualify. Turning to the key product features, similar to other products in this category, Home Care Secure utilizes entry age pricing and is guaranteed renewable. So let me use an example to bring that to life for you. Let's take two males purchase a $60,000 lifetime maximum policy with the 3% inflation rider. One purchases at age 50. For that individual, the monthly premiums are $72. One purchases at age 60. For them, the premium is $107. At age 80, both will have paid $26,000 in premium. However, the individual who purchased at age 50 had 10 additional years of coverage and has an available lifetime maximum benefit of $103,000, while the individual who purchased at age 60 obviously had the policy for 10 fewer years, and their lifetime maximum benefit is only $85,000. Now, to have the policy keep pace with wage inflation, there are two mutually exclusive options, the inflation protection rider and the $10,000 buyout. So let me cover the key components of each. First, the inflation protection rider. So that's a decision that your client makes at policy issue. The interest rate is 3% simple interest, and it begins in the 7th policy year. And there's no limit to the increase in the lifetime maximum while the policy is in force. So for example, a $50,000 policy with the inflation rider after 30 years will have grown to $86,000. Now the alternative to that is the $10,000 buyout. And the buyout is available every 3 years or more. However, it's subject to a lifetime maximum benefit of $60,000. So to continue with the example that I used for the inflation protection rider, someone who purchased a $50,000 lifetime maximum benefit would only be able to buy up one time because they'll be at $60,000 then. The next feature is the fact that the lifetime maximum benefit grades over a 5-year period. Clients have access to 10% of the lifetime maximum benefit on the first day of the policy year, and it grows to 100% in the 6th and subsequent policy years. So what was the rationale behind offering this feature? Well, it allowed for simplified underwriting and more competitive rates. And while none of us can predict our healthcare future, individuals generally purchase these type of policies 5 to 15 years or more before they anticipate needing the cash payments. And obviously in these situations, the grading schedule is effectively not applicable. Now, the last feature I'd like to share with you is the multi-episode of care. And the headline here is that Home Care Secure can be used episodically over an extended period of time for acute healthcare conditions. And one episode of care ends when your client recovers and does not need home healthcare services for a minimum of just 30 days. Finally, claim qualification requirements. So how does one qualify for the weekly cash payments? So there are essentially three. First, a licensed healthcare provider, which, while it can be a physician, doesn't have to be, can also be a registered nurse or a licensed social worker. So one of those healthcare professionals must certify that your client suffers from a physical or cognitive impairment. So a physical impairment, traditionally, much like long-term care insurance policies, is the inability to perform 2 or more of the activities of daily living, such as bathing, dressing, transferring. A cognitive impairment, for example, is a dementia diagnosis. So that's criteria 1. Second criteria is that your client needs home health care services at least 3 times a week, and each visit is at least 1 hour in duration. And then finally, all of this is documented in a plan of care. And as Liz mentioned earlier, because of the indemnity nature of the benefit, the weekly cash payments are made directly to your client. So let's take a look at the state availability map. So the states in green, the 22 states in green, are where home care secure is available today. The states in gray come in 2 flavors. Those with the abbreviations within their borders are states that are targeted for the second half of 2022, and then those without the state abbreviations are targeted for 2023 and after. Let's take a peek at the underwriting questions. So here are the 5 knockout questions, and while you're reviewing them, let me leave you with some thoughts. The process is simple, yields real-time determinations at the point of application, and is easily attainable. Note that the questions are very narrowly scoped, and as I mentioned earlier, 90% of your or more of your clients will be able to qualify. Liz?
Great, thank you. So now that we've reviewed the insurance component of the offering, I'd like to take a few minutes to focus on some of our support services. So as we highlighted, we were very purposeful in the design of both the product and the association. Since we've been in this position ourselves, either being a caregiver or having to seek or search for caregiver services, we know how overwhelming the process can be. In addition, with our vast experience in the insurance industry, we've seen far too often that people don't learn about their insurance, right? They don't understand their benefits or expectations around levels of coverage, and they don't look into it until they're sick and at their most vulnerable. Thus, they're not usually equipped to make the best decisions. Therefore, we wanted to bring together the tools, the resources, and the navigational supports to help individuals and their caregivers in advance of their time of need, so they have increased peace of mind. And as part of this peace of mind, we wanted to ensure that the association provides valuable benefits and discounts, which align with our mission to age at home. And the beauty about these offerings is that they're available not only to the policyholder, but to their immediate family members as well. So just to give you a few examples and provide you with a little bit of flavor of what we offer, we do provide free unlimited telehealth visits through our partnership with MD Live, access to discounted care coordination services, as well as discounts and access to will and estate planning services. All of these provide immediate value to your clients, totaling several $100s per year in savings on average. One of the benefits, however, which is truly differentiating, involves our unique partnership with Wealthy, which provides concierge care coordination services. And Nick actually has a personal story on this front that he'd like to share.
Yes, and my personal Wealthy story will resonate with many of you, as you've either gone through it personally with a member of your family, or you've observed a friend or client go through something similar. But several years ago, my dad passed away, and my mom made it very clear that it was her wish to continue to live in the home that she raised her family. But unfortunately, over time, she was becoming increasingly socially isolated. She was exhibiting memory loss and was clinically depressed. So clearly something needed to be done. And like many families, I live several hundred miles away from where I grew up, and I had been out of the community for decades. And thankfully, I had Wealthy to turn to. I was paired with a care coordinator, and my particular care coordinator had a master's in social work with a focus on elder care. And we had a couple of phone conversations where I brought her up to speed on the situation and what we were trying to accomplish. And out of that, she created a holistic care coordination plan that had 3 components. First was addressing the immediate need, and in so doing, she identified resources in the community to allow my mother to continue to safely live at home. Secondly, recognizing the trajectory of her health with the memory loss, she researched and vetted within a 25-mile radius of where my mom lived, assisted living facilities and nursing homes, and with a focus with those that have memory loss units. And then finally, she identified a financial aid program run by the Veterans Administration, with which my mom is eligible because of my dad's military service. Now, because of all these efforts, my mother was able to live at home for an additional 2.5 years and is currently a very happy resident at one of the vetted assisted living facilities. And I often think about what would have happened if I did not have Wealthy to turn to, and clearly would have been much anxiety and sleepless nights, would have made mistakes, and that's plural, but ultimately my mom would not have lived at home as long as she did. So I hope this experience brings to life the value that Wealthy and its care coordination services can bring to your clients in their time of need.
Great, thanks so much, Nick. So with the insurance and the association, what does all of this mean? So let's meet retiring Ray, who is a persona that we created to bring these elements together and make them real for you. So Ray purchased the $50,000 policy with the inflation rider when he was 65 at a monthly premium of $109.57. Now, I do want to point out we were very particular about selecting this level of coverage for the example, because if you recall earlier, I had mentioned that the averaged unreimbursed out-of-pocket custodial expenses are roughly $50,000. And this is an expense that 2/3 of us will encounter in our lifetime. At the age of 80, unfortunately, Ray requires in-home custodial care and needs to go on claim. Now, by this point, Ray has made monthly payments in the amount of $19,700. Yet if you look here, Ray has an available maximum benefit of $63,500, which reflects the $50,000 policy plus the inflation rider, translating into payments of $1,270 every week for up to 50 weeks. And since Ray's been a client for 15 years, he's been taking his annual well-being assessment. He's been leveraging the available tools and resources. Ray and his family have had discussions. They know what to expect from a benefit perspective, and they have an aging at home plan in place. And now they're just executing on that plan with increased peace of mind. And with that, I'll turn it back to Nick to close us out.
Great. So a little coming attraction. So I'm going to, over the next 3 slides, I'm going to talk about the addressable market, target buyer characteristics, and go over some use cases with you. So first, addressable market. So the headline here is that there are 126 million households in the United States, and 50 to 55 million of them would benefit from Home Care Secure. So let me orient you to this slide. So this slide illustrates the number of households in the United States by age, employment status, and investable assets. Each individual block represents 100,000 households. The blue blocks are actively employed individuals under the age of 55. Green blocks are actively employed age 55 and older, and then the yellow blocks are retired individuals. Households are then grouped into 6 investable asset categories, ranging from low net worth, defined as having assets of less than 100,000 on the far left, and that's the biggest grouping of blocks, to the mega millionaires on the far right with assets of 3.5 million or more, which is the smallest grouping of blocks. The red dotted box represents our perspective on the households and individuals within those households which would benefit from Home Care Secure. And it's essentially the upper quartile of low net worth extending to the lower quartile of high net worth. You might ask yourself, why isn't it everyone? Well, on the low end of low net worth, there's premium affordability issues, and those on the upper end of high net worth and the mega millionaires can fund the cost of home health care services out of personal savings. So let's talk a little bit about target buyer characteristics. So individuals will purchase Home Care Secure for a variety of reasons, including life stage, financial considerations, and personal expectations and experiences. And it's important to keep in mind that these are not silos, and individuals can possess characteristics in multiple categories. So let's look at some representative sample. So first on the far left, life stage. So individuals in their 40s likely experienced a loved one, for example, a grandparent or parent, go through a physical or cognitive decline. And that's a very powerful motivator. Individuals in their 50s through mid 60s are beginning to think about and plan for retirement and what that might look like for them. Finally, individuals 65 and older are considering care options as they age. Now, from a financial consideration perspective, we just discovered from the previous slide that 87 million households have investable assets of less than $100,000. And Liz shared with us earlier the fact that the average person will consume $50,000 of unreimbursed custodial home healthcare expenses from retirement through end of life. Thus, for the vast majority of Americans, retirement savings are insufficient to cover custodial home healthcare needs. Educating your clients on the potential gap in their financial plan and providing them with a cost-effective solution is the right thing to do for your clients. And then finally, from a lifestyle expectations perspective, we all have a strong desire to independently age, both physically and financially at home. Always been a strong motivator, but even more so in this pandemic environment. So let's review some use cases. I've got three in mind. Medicare, ACA, and employer-sponsored benefits. So first, Medicare on the far left. And this is kind of a natural one. And I'll highlight two scenarios: individuals aging into Medicare, as well as those already on Medicare. First, the scenario of individuals aging into Medicare, which, by the way, fun fact, 10,000 individuals in the United States age into Medicare each day. Now, chances are that their monthly financial obligations for Medicare will be lower and potentially substantially lower, especially if they purchase a Medicare Advantage plan, than their employer-sponsored healthcare costs. So here's a great opportunity to educate your clients on their potential financial exposure and redirect some of the premium savings to fill the gap with Home Care Secure. And for those of you that have clients that are currently on Medicare, Home Care Secure is a great reason to check in with your clients after the close of the open enrollment period. Now looking at ACA, the Affordable Care Act, leveraging the power of the American Recovery Act. To provide a refresher, the American Recovery Act increased the premium and plan design subsidies for individuals who earn below 400% of the federal poverty level. Additionally, it introduced for the first time subsidies for select individuals who earn in excess of 400% of the federal poverty level. So the rationale here is the same as those aging into Medicare. It's an opportunity to educate your clients on their potential financial exposure and redirect some of the savings, which in this case are effectively the increased subsidies, to fill the gap with Home Care Secure. Finally, employer-sponsored benefits. For those of you that work with employers in a group benefit setting, if you've been following the trends and speak with voluntary benefit platforms, you know that the next big thing in voluntary benefits is caregiver benefits. Here's some facts. 45% of employees have caregiving responsibilities. The annual cost for full-time employees to employers with caregiving responsibilities is in excess of $17 billion. And that works out to over $2,400 per full-time employee. So pretty significant financial impact to employers. Home Care Secure is a voluntary worksite benefit that really benefits everyone. So look at it from the employer perspective. The employer is offering a valuable caregiver benefit, and it's a benefit that doesn't require a heavy lift on their part. For example, because Home Care Secure is not an ERISA plan, there are no annual filing disclosures, summary annual reports, no discrimination testing, no minimum participation requirements, and because premiums are paid with bank draft, no payroll deductions to worry about, and no one to notify when the employee terminates. Very simple to the employer. From the employee perspective, here's a fully portable benefit that fills a significant need in their financial plan. And then from all of your perspectives, you think about it, each employee represents potentially multiple sales opportunities when you consider not only the employee, but their spouse and potentially parents and in-laws as well. So let's talk about the opportunity. So why should you introduce your clients to Home Care Secure? So there's opportunities for your clients and for each of you. Each of you are trusted business advisors to your clients. And here's a great opportunity to reinforce that position by educating them on a potential gap in their financial plan and introducing them to a solution to protect their future and provide them with peace of mind. We realize that your time is your most precious resource. Thus, we designed Home Care Secure to be easy for your clients to understand, affordable, experience high acceptance rates, 90% or more, and save time with an efficient quoting and enrollment process, which takes up 10 to 15 minutes to complete. So let's talk a little bit about agent resources. And all of us at Premier HCG Secure and Guarantee Trust Life are laser focused on your success. We've developed a number of client-facing materials, such as an explainer video, product brochure, customizable postcard, infographic, and other assets to assist your marketing efforts. As well, we're fully leveraging GTL's technology platform, including eApp, which is their online quoting and enrollment tool, and GT Link, which is their agent portal. So let's talk about what's next. So what's next? If you're currently appointed with GTL and contracted with Premier, you're ready to roll. If not, we have Katie's contact information, her email and direct phone line, and give Katie a call or drop her an email, and she and her team will get you contracted and in the market as quickly as possible. So with that, we thank you for attending today's webinar, and I'm going to turn it over to Katie to see if there are any questions that we could cover for you before we close.
Thank you guys so much. I really do appreciate it. If anybody does have any questions, I see here one question that's coming in is issue age. What are the issue ages of this product?
So it's age 35 through 84.
Perfect. Another one was regarding state availability. Do we have timelines on any of these, or as you, and I'm guessing it's because you have the different rollout. They're asking about timelines on any of the states out west.
Yeah, so anything with an abbreviation in its borders that's in gray will be in the second half of 2022, and to be candid, it'll probably be the fourth quarter of 2022, and then those that don't have the abbreviation will be in 2023 and beyond. And the truth is as well, there are some states that are not short-term healthcare friendly and will never likely approve Home Care Secure or any other short-term home healthcare product. Like Florida is a very difficult state, for example. New York is a difficult state, and there are probably 15 states that fall into that category.
Sure. Another question is regarding the underwriting process. What exactly goes on behind the scenes? Is there medical records, cognitive screens, or what exactly is going on the underwriting side?
Yeah, the underwriting side is very simply responses to the knockout questions. There's no tapping of RX databases or medical databases. There's no phone interviews. It's if someone can honestly answer no to each of the 5 knockout questions, then they qualify for coverage.
I have some people asking if they're going to get a copy of this presentation. Yes, we do record our presentations, and I will be sending it out with the recording for your review in the future. So if there's additional marketing materials or anything of that nature you're interested in, just let me know. One other question on the underwriting is, what is the look back?
Well, there is a pre-existing condition limitation. And maybe the person who asked the question is that the?
I'm thinking
that's not what you're asking.
That's exactly what they mean, is that with our other short-term care carriers, there could be a 6 months of basically a pre-existing condition clause, meaning that you cannot utilize it if you have any pre-existing condition at time of app. So I think that's what the question is do you have one of those?
Yeah, there is a pre-existing condition limitation, and I have to go back to refresh my memory on how it operates, but I believe it is. I shouldn't guess. I should find out what it is exactly.
We can include that as part of the follow-up with the recording.
Yeah, and let me just add this: if the question was related to the look back on the health-related questions, they're 12 months. So if you can see, like, if the applicant answers yes to any question, blah, 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 within the past 12 months, have you been And then before questions 3, 4, and 5, within the past 12 months, have you required, dot, dot, dot. So as it relates to the health questions, it's 12 months. As it relates to the pre-existing condition question, we'll get you that information in the follow-up.
Fantastic. Well, beyond that, I think we've handled all the questions. Nick, Liz, Thierry, I really appreciate you guys joining us today. This is great stuff.
Our pleasure.
And
Thank you.
oh, here I have another one coming in. It says here, is this a replacement for long-term care insurance or for people who do not like long-term care expenses?
Well, it is not a replacement in the sense that it does not cover institutional care. Like it doesn't cover assisted living facilities or skilled nursing facilities. It could be a complement to long-term care. So for example, it could cover home health care expenses during the 90-day waiting period that may exist in a long-term care insurance policy. Like that could be one way how this policy could complement, a long-term care policy. It could also serve as, let's say somebody, long-term care policies are medically underwritten and the rejection rates are quite high. Maybe I'll look at it in the positive way. The acceptance rates are lower, right? They're 65 to 70%, versus 90% for home care secure. So you might have a situation where someone doesn't qualify for long-term care. This may be a good alternative to that, but again, it be very, very clear. It doesn't provide long-term care coverage. You have to be very, very careful that it's limited to home, home health care services.
Perfect. As an extension of that, I think that's a good point, is that while it's not a replacement, sometimes it is what people can afford. It is providing the home care that some people are looking for. Some people are not interested in the facility side, or maybe, like you said, they have some health conditions. And traditional policies, they will not offer coverage over age 79. So these short-term care products, similar, this one included and including all the other ones that we carry here at Premier, we have policies that will issue up to age 89. So if we do have that over 65 market that maybe has a tighter budget or something like this, while it's not the traditional long-term care planning or the product that they may have in mind, it may formulate somewhat of a solution. And the other opportunity that we always see too is a lot of the old long-term care policies maybe had limited home care or no home care at all. So while your client may say they bought a policy in the early 90s, reviewing that policy, and if you ever need any help, you feel free to give me a call, but in looking at it, you may find that there's a deficit where these kind of products are really putting home care at the front of their list of needs and providing where there may be a hole in their existing coverage. So that's just something to keep in mind. That's where we do see great amount of opportunity in the short-term care arena. So.
Good point.
Well, I think we've handled it. If anything else comes up, please feel free to give me a call here at Premier. As you saw, I have a direct line and my extension is 226. Oh, I have one more coming in, Nick.
Sure.
How many weeks are your policy going to provide coverage?
50 weeks.
And is there a restoration of benefit option on it?
There is not.
Okay. Perfect. Well, at that,
Awesome.
I look forward to hearing from each and every one of you. And again, Nick, Liz, Tierney, I really appreciate you guys joining us today.
A pleasure. Thank you.
For everyone else, enjoy your day. And I look forward to working with each of you. Have a great one, guys.
Great. Thanks so much for having us.